Hey everybody, Regan Archibald back again, your thyroid expert, and I'm here to share with you kind of phase 1 through 3. I'm going to walk you through in the next two videos what it looks like to look at your other testing, like your saliva test and your stool test, and why that is so important in the overall care plan to get to the underlying cause of your thyroid. As you know from video 1, we go through a comprehensive blood review. We really analyze the data. We give you nutritional advice. We let you know what vitamins you're depleted in, nutrients and minerals. And then we also give you just an overall nutritional plan. But that's where it begins. And a lot of doctors stop there. And so in our 3-4-5 method, everybody gets the correct tests, the correct treatments, and the correct teaching curriculum. And so you'll have a health coach, a mentor, somebody who works with you. And then in the process of removing what's not necessary, one of the tests that will be recommended is a stool test. And so if you've never done a stool test, it's not glamorous. And you're probably saying, oh man, what do you mean a stool test? Well, the most important thing about having a correct stool analysis is it lets us know if that's one of the primary causes of thyroid issues. And I can tell you, in treating thousands of patients who've had Hashimoto's, hypothyroidism, Graves' disease, if you don't look at the stool, you're missing one of the most important functions of this entire process. And so make sure that you get this ran. So number one, we're going to look at maldigestion. How is your digestive system functioning from an ability to take nutrients and absorb those into your body and make hormones out of those? The second thing we look at is inflammatory patterns. So, part of what we look at is your secretory IgA elevated. That means, do you have food reactions? And I can tell you, most people who have thyroid issues have a lot of food reactions. So we look at maldigestion, inflammation. We see if you've got leaky gut, if there is blood in the stool. All those things are really important. And then the third thing we look at is dysbiosis. And that's a fancy word for basically saying that your bacteria is not balanced in your gut. And I look at the bacteria as our second brain because these creatures are so powerful. I mean, we have more genetic material for bacteria than we do human cells and human DNA. And so if you look at it, we have a symbiotic relationship. And when there's dysbiosis, that means there's a break in and a fracturing in the relationship. So we want to remove any dysbiosis and build up these healthy organisms, because your gut is like a farm and it's like soil that you've got to fertilize. And then the fourth thing we look at is metabolic imbalance. This means, is your beta glucuronidase off? How are your short chain fatty acids? And these are the foods that the bacteria love to eat on. So this is like the fibers that you get from plants and from some of those resistant starches from some of the carbohydrates, the complex carbohydrates we eat. How's your butyric acid concentrate, and what's the percentage of these properties? And so you can see my patient here had a metabolic imbalance of 10, and she was withering away. Her thyroid would get cranked up into a hyperthyroid, and then it'd drop into a lower, then hyper, then low. And then she finally, stabilized in more of a hyper state. And now we've been able to bring that down just through getting the correct labs tested. And so she'd been working with functional medicine doctors on her thyroid for years, but none of them had ever tested her overall digestive profile. Once we did that, then we realized, here's the problem. The fifth thing that we test for in the top 5 in this stool test is infections. Do you have an infection in your body? What's the total abundance of bacteria? Are there parasites? Is there fungi overgrowth? Pathogenic bacteria? Klebsiella is a very common one that we see that can be very dangerous. Low firmicute. Akkermansia is one that tends to be low in a lot of our autoimmune patients who have blood sugar dysregulation. So we may find that you have an Akkermansia imbalance. And then we'll tell you what foods can actually feed the good, healthy critters and what foods you want to avoid based on the stool profile as well. And then many of you, we may take you through what we call the repair and clear process. But once again, it's not based on guessing, it's based on your test. And so that was an example of what one of our stool tests looks like. When you come in, the very first promise that we make is we're going to have 100% certainty. We're going to give you guidance on what direction that you need to go in. And we'll give you a step-by-step curriculum to get there. As you go through this process, I want you to be prepared so that you know what to expect. So in the removal process, The removal process will be based on your blood work partially, but a big primary thing that we base your phase 1 of care, which is the removal of inflammation, removal of triggers, is also going to be on the gut profile. The other removal of triggers that we're looking at are 4 things. So we look at the emotional triggers, we look at the physical triggers, we look at the triggers to your immune system, and we look at the chemical triggers. All 4 of those have to be addressed if you want to move forward and advance in your thyroid health. And then as we're removing those, then we enter into phase 2 and phase 3, which is the repair and the restorative and regenerative phases. And that's when we focus on the 5 core pillars of health. And I mentioned this in the first video, so I apologize, but I think it's really important you understand that you've got to have all 5 pillars corrected if you want to make progress in your thyroid. I couldn't make progress in mine until I worked on all 5 of these, which are gut health and detoxification, nutrition, hormonal health, looking at exercise and fitness properly, and then the biggest one for me was brain health and cognition. So all these 5 pillars are met, you get the correct testing, and we will go down and take you on a course of action that will get this problem solved for good. That's our goal. Our promise to you is we will keep digging. We don't leave any stone unturned. So I hope this video was interesting. We can't wait to see you in the office soon. I've got one more video coming your way where I'm going to show you the entire program. We're going to talk about phase 2 and phase 3 in your care, but I'll show you a program design so that you understand what happens on the back end as a team as we build out your overall program. So look forward to seeing you soon. Take care.